Hi guys, my name is Sass. I'm a nurse practitioner with Peacock Pediatrics, and today I'm going to talk to you guys about the 9-month-old and the 9-month-old visit. So we'll start off by talking about feeding the 9-month-old. At 9 months, you will notice your baby is becoming a lot more independent, and you can kind of get creative with what you're feeding them. So again, their main source of nutrition until age 1 should be formula or breast milk, but at 9 months they can really eat anything they don't choke on. So we want you to get creative with things that you're offering them meat and fruits and vegetables, and different textures and different flavors, and then having them try to kind of feed themselves a little bit more independently. We want them sitting down with you and the family for meal times 3 times a day, and 2 to 3 snacks a day, and kind of really getting, creative with the table foods you're offering them. So babies this age and a little bit older and a little bit younger will say no to foods about 10 to 12 times before they'll try it. So if you offer your baby some like diced avocado and they don't want it or you don't think they like it, just keep offering it to them. The more times they'll kind of be a little bit more receptive to trying it, and it may be their favorite food. At this age, we also want you to kind of teach your baby how to use a cup. So it's okay to still be giving bottles before their first birthday, but offering them a cup at these meal times and kind of teaching them how to use it. This is a really good age to start doing that. So again, we kind of talked about the breast milk and formula. That is what their main nutrition should be. They won't start getting cow's milk until they are a year old. Kind of daily routines are something that's super important, and you'll hear us talking a lot about at your visits, and they're really important for meal times, bedtime, kind of all throughout the day, playtime. And so when they can anticipate their daily routine, it helps things go a little bit more smooth. So when they know around dinner time, that's when they sit down in their high chair with the family and they're offered all these foods to try to eat. And then after meet their meal time, they have bath time, and after bath time they get their lotion and their jammies on, and then it's wind down time about an hour before bed. And the 9-month-old should be going to bed around like 7 to 8. 7:30 is kind of that magic window of laying the baby down, and they at this age should be sleeping through the night. They no longer need the nighttime calories, so they don't need bottles at night. We don't want you giving a bottle in the crib, and they can get fed before bed, a bottle, and then when they lay down it's bedtime. They can still do a binky, or anything to kind of stay calm. If you are having trouble with nighttime wakenings, you want to make sure when you're going in to reassure them that you're not picking them up or making it a fun time. It's very boring. You're going in kind of just getting right to business, and making it kind of a boring interaction so they're not wanting to get out of bed. And they know when you come in, you're going to just lay them right back down, give them their binky, reassure them, and leave. Next is toys and things to play with. So reading lots of books at this age is so great. Interacting, describing what you're giving them. So saying like, do you want to play with the ball? And then even though they'll say ball back to you, but having a conversation with everything you're doing and everything they're seeing can really help those language development skills. Talking to them, singing with them, reading with them, all very important things. As far as safety goes, we still want these babies backseat in the car, in their car seat facing backwards, strapped into it every single time. At this age, we also are expecting them to pull up to stand. So things that we'll want you to kind of start considering and doing once they can pull up to stand, their crib mattress needs to be lowered, so that we're not, concerned about them going over the crib rail. Also making sure there's no standing water, so emptying buckets, emptying bathtubs, pools, all those things, because as your baby becomes more mobile, those are very unsafe to have. Getting in the habit of, as soon as the bath is done, before you even get the baby out, let the bath water out. We want you to be placing gates on stairs, so that the baby isn't going down the stairs or trying to go up the stairs and falling. Not leaving heavy or hot things on tables with tablecloths that the baby could, crawl to and then pull down on themselves. Getting safety devices for under your cabinets and medicine cabinets and things with poison and that kind of thing, making sure you know the poison control number. If you have a gun in the house, at any age child, they should be locked in a safe with the ammunition stored separately. Other things to work on for this age group is to have them be trying to wave. So when you're coming up to them, saying hi with the wave, and when you're leaving, saying bye with the wave. If they have teeth, any baby that has teeth, you can start brushing their teeth, whether you use just water or a tiny bit of fluoride toothpaste. All teeth should be cleaned, and then making sure that older siblings kind of know these safety things, so they're not giving the baby anything that they can choke on, keeping bags and any small tiny toys away from the baby, and making sure older siblings understand what's safe and what's not safe for baby. The 9-month visit that you'll come see us with, they will not get any vaccines unless they are due for a flu shot or anything in the fall time. But their next vaccines will be at a year old. And if you need anything or have any questions, we would be happy to talk you through with it, or see you in clinic. Thank you.